Car accidents. It doesn't happen too often, but once in a while animals, both family pets and strays, are involved in car accidents. Stray cats like to hide under parked cars. Dogs are more active and communicate while not on leash. Might cross the street if they see interesting animal or hear a sudden sound. It's risky. If a heavy car hits a small animal, it usually kills them, but a certain percentage of these accidents cause trauma that can be handled with quick and proper help, allowing the animal to survive. Our doctor's a neighbor opened the door to throw away his garbage, and his miniature pincher ran out. Unfortunately, another neighbor had started his car at the same moment. The speed has not yet accelerated, and this saved the life of the pincher. Impact was light. Anyway, the dog's hip was broken, and there were huge blood-covered bruises all over his side. The dog was choking from the pain, which could have been more life-threatening than the trauma alone. Fortunately, the doctor was there and started treatment right away. They brought the pincher to the clinic, and the necessary diagnostic tests, supportive treatment were quickly administered. Within a month, the pincher was pretty much back to normal, but his fear of car was lasting. Now he refused to come close to standing car, including the car of his owner. Severe punishment help you learn fast. A cat fell asleep under the car, and when the engine revived up, she panicked and ran out right when the car can start to turn its wheels. The poor cat rolled like a ball, and a teenager happened to pass by, spotted the car, took it in his arm, and ran to our clinic. There was no visible damage to the cat, but her condition kept deteriorating. Suspected internal bleeding, the doctor opened the belly and found disruption to the cat's liver. Disruption could be fixed, but the cat needed a blood transfusion to compensate for her loss. We asked any clients who had brought their cats for a checkup that day to donate some blood. All of them sympathized with the injured cat, but nobody agreed to do it. They just stared at the waiting room floor. Luckily, one of our technicians who lived close by had a healthy cat and agreed to help. The doctor performed the transfusion, but the injured cat needed more blood than we could take from one cat without hurting him. We gave a call to several rescue people and found that one of them had a couple of cats for adoption. The doctor checked those cats for contagious diseases and took blood from them. Since then, we have always kept an eye out on orphan dogs and cats as potential donors. Just in case, a visitor brought his beagle for a checkup. Doctor, please find something wrong with my dog. Well, there is a strange request, said the doctor. Why are you so worried about your pet? Did you notice anything abnormal? Okay, doctor, I just got into the car accident. My dog was in the car with this was noted by the police report. My insurance company has no fault policy. Maybe Convulsions. A very tall man brought in his poodle for grooming. The owner had not gone far when we called him on his cell. Please come back as soon as possible, we told him. Your poodle is having convulsions. As soon as the groomer had placed the 6-month-old poodle on the table, he fell into serious epileptic seizures. This breed is a predisposition to epilepsy, but it doesn't normally begin in such a young age. The seizures lasted minutes and follow each other very closely. Seizures that long last a minute or occur one after another can kill an animal. His name was Lucky, and his only bit of luck was that our veterinary hospital was right next to the grooming. Sedatives were administered through IV, and the seizures ceased infrequently. C. The main risk in this situation is the possibility of brain molluscus. If this happens, the dog may die. The doctor treated him in order to avoid this worst-case scenario, and finally his condition stabilized. Now we had the chance to pay attention to the owner. It was painful to look at him. The face of this massive, somewhat trash-looking man was covered in tears. He well understood that incident was nobody's fault, just a bad luck of genetic roulette. But he felt a paternal feeling towards this poodle. Lucky stayed with us for a couple of days, and throughout he recovered from the accident. Diagnosis was lifelong condition. The doctor provided the owner with preventive medicine. While this does not guarantee Lucky's health, it should reduce the frequency of seizures and their severity. The owner spent hours and hours in the hospital. We became friends. He told us that he is a pilot, that he flies huge airplanes, has a good family, but his dog is like a child to him. It was surprising to see this strong, massive man so emotional over his body. Do you know why people call their pets my baby? I've thought a lot about that. That's what I came up with. Among the many possible reasons, there is one certainly difference between adults and kids. Adults usually try to plan everything ahead of time, and kids just live in the moment. When I first came to US, I was surprised that apparently normal, not overly sentimental man and a woman with sons and daughters refer to their pets like this. It was absolutely unheard in my previous life. Actually, it was even a bit shameful to name a real son and daughters by the same names as dogs and cats, and even guinea pigs. In addition to love and other feelings, when family relationships are projected only connections with animals by lovely people, there is one other clear similarity. Young kids and animals have no inclination towards long-term planning. Adults buy insurance for their pets. They expect that later, maybe years into the future, something might happen to them and they will need a lot of money for treatment. They vaccinate pets thinking of possibility of future diseases. They make appointments months ahead of time to groom them, and so on and so on. On the other hand, kids and animals live together today. Even now, at maximum a few moments ahead of the event, they see the chance to play, they start the game. They feel hungry, they start begging for food. They want to pee or poop, they start looking for appropriate spot. It isn't the way to go to be happy now and not worry about future problems. Emergencies. Emergency cases usually generate more profit than regular ones, but in order to declare our clinic an emergency hospital, we would have to adhere to a lot of regulations. We choose another way. We extend our working hours late into the evening and weekends. This works because owners tend to notice emergency situation when they came from work and discover that their pet is terribly sick and needed help right away. If nothing serious happened before 10 p.m., they usually go to bed. Emergencies that occur late at night are rather rare, so by extending of our hours into the evening, we got a significant part of the profitable cases without having to go through the hassle of applying for permits. Of course, emergency visits require vet to have certain qualifications as well as well-coordinated efforts of the vet tech team, including the receptionist and the management. This is because payment can cause issue in case of emergency, as people might not be prepared for significant spending, and we do not want to refuse sick animals. On the other hand, we cannot perform those services for free. We have to think about materials and salary costs. So emergency work leads to complicated paperwork for assistants who have to address each unique situation during the rather limited window. Have to figure out how we can help sick animals without losing money. On the other side, emergency cases can bring a lot of satisfaction to those who save lives. Yes, the routine vaccinations of puppy also prevent death from serious disease. but it's not as so satisfying as stopping severe bleeding, blowing a bladder, and getting a heart restarted. Sometimes an emergency case may cause a smile. Other times it might induce a lot of sweating. On the 1st of January, many businesses are closed for New Year Day. Plus there is a huge storm, snow, and a few cars on the road. We have several patients in the hospital and boarding facility full of dogs. They have to be fed and walked and medicine to be administered. No choice, I have to go to the clinic. I'm sure that the other employees will be able to, I'm not sure if other employees would be able to reach the office. I worked through snow up to my bones. Fortunately, all the other coworkers have thought the same thing and the whole team is present. Due to the weather, it seems obvious that nobody will visit us today. After performing the necessary steps to care for our in-stay animals, we are ready to take it easy, make tea, chat, have a holiday lunch together. As soon as this tea is almost ready, the first visitor comes, the mother and the daughter who drove their jeep, making a strenuous effort to bring us their female cat. What's wrong? It's an emergency. Our cat cried a whole night. Let's see what happened to the cat. We take a look. It's just regular heat. The doctor announced his diagnosis within a few minutes, but she has to be spayed. But there is no rush. It would be better if you wait until the heat ends and less risky surgery. During heat, the vessels of the uterus are full of blood and might make the surgery much more difficult. No, we cannot wait, she said. Another night like this, and we will need to hire psychiatrists in our own sanity. Please help us. Extra money is not an issue. A few minutes later, another visitor walked in. His miniature poodle found leftovers from holiday dinner in the garbage bag, and the chicken bone is stuck in his mouth. The poodle can hardly breathe and is choking, coughing non-stop. The technicians prepare their surgical tools, anesthetic machine, and other necessary things, while the doctor puts his finger in the poodle's mouth. The poodle coughs especially hard, and the chicken bone falls off. The poodle is safe. A young couple steps and the entire floor is covered with snow from their coats. They bring in Chihuahua, and the dog is behaving strangely. Her eyes are moving quickly from one side to the other, and she is trembling like crazy. Her heartbeat is elevated. The only good thing, the dog looks happy. It's wagging its tail all the time. It's their 5th or 6th visit with the same symptoms, so no problem with the diagnosis. The young couple are fans of marijuana, and once in a while their dog eats their pot, which she finds in their apartment. We administer fluid therapy, detoxification, supporting treatments, etc. A nice-looking young lady with a boyfriend to match bring in her cat. The long-haired Himalayan is meowing, and his left side is covered in blood. The lady tells the doctor that this cat is beloved baby. She takes care of him and brushes his coat carefully almost daily. But today she found a mat under his left front leg. Her boyfriend suggests to cut this mat with manicure scissors, and she agreed. One touch and a small piece of skin was cut off together with the mat. It was such a tiny stretch, explained the lady, but when I tried to clean it with the peroxide, the cut started to grow and grow. Now it's a big wound. Help him, please. It's not such an unusual case. Many people think they can save money on cats grooming, doing the job themselves. When they cannot mat the tangled hair, they just cut it and often damage the cat's skin. The problem is worse because the cat's skin is very delicate, and any small cut can develop into big wounds. We're not talking about stray cat warriors here. Their skin is often hard as concrete. Sometimes it's even difficult to stick a needle in these street fighters. Sedation, local anesthesia, cleaning the area around the wound, numerous stitches, antibiotics, pain management, e-collar, bandages on the rear legs to prevent licking and scratching of the C wound, and a bill. A boyfriend pays it. It looks like this payment would not be the only punishment that they given his poor advice. And so emergency visit the whole day. We even forgot about tea and lunch. Why could have imagined such a busy day and a stormy day, stormy January 1st?